for being here this morning and for joining us. We are so excited to be able to hear from our experts from around the world in the FIP African region. I will share my desktop. There we go. And we are off. Welcome, everybody, for coming here today to participate in this digital events series as part of the Academic Policy and Advocacy Working Group. And we are very excited to spend our time together today learning from leaders around the world in the FIP African region. So as you enter today, we're going to have some questions that we want you to think about. We would love for you to share either in the polling question or in the chat for us, thinking about what is your background with experience in education and advocacy, and what type of practitioner you feel that you belong to. Are you an educator? Are you an accreditor? Are you a policymaker? Are you a student, or are you involved in industry or other roles in your country? And then finally, we would love to hear your answers with what is your level of experience or comfort as it relates to educational advocacy and policy. We'll use this to help tailor our thoughts and help customize some of the content that we provide in the future and in today's session to engage with you as our participants and to make this a more meaningful session today. Without further ado, I would like to welcome Jeanine Abrons. I'm a director of International Student Pharmacist Activities at the University of Iowa College of Pharmacy. I also am a co-director for University of Iowa Mobile Clinics, and I am a clinical associate professor with the College of Pharmacy. I am also having the pleasure of being one of your newly elected executive council members for the FIP academic section, and I am so thankful and excited to be able to serve you in that role and to engage with you, not just today, but in the future. And we have our lovely member of our academic section working group, Onyeka. Going to introduce yourself, and then Onyeka's also going to introduce her stay, and then
Yeah, hello everyone. I hope I can be heard. I'm so glad to be here. Jeanine, please indicate my voice is clear. I had a little network glitch.
we can hear you well.
All right. Thank you very much. So, hi everyone. My name is Onyeka Obidiegwu from Nigeria. I'm currently the Assistant Secretary for the Pharmaceutical Society of Nigeria. I will transition to Secretary fully by tomorrow.
There we go. Onyeka, you cut out for a moment for us today.
All right. Is it clear now?
It is clear now.
All right. Sorry. Network is acting up. So I was the Assistant Secretary, currently the Secretary for Pharmaceutical Society of Nigeria, Anambra State Chapter. I'm the region lead for this advocacy session. I'm so glad to be here, and I enjoying us to have a very good time, a very nice learning session today. So thank you very much. Over to you, Jenny. I hope I was heard this time.
That was great. Okay, we're also going to have a couple of facilitators today in our background. So we have Nadia Mazari from the University of Sharjah in UAE with us today. And we also have Barry Blight. And Barry is a president at the Health Resources Consulting and both are vital members of our FIP academic policy and advocacy working group. So they will be with us. They will say hello in the chat, and they will be answering any questions that you might have. They will be collecting those questions that you have, and we'll incorporate that into later parts of our webinar today and our discussion. Okay, so Onyeka is going to introduce our prestigious panelists today that we will learn from the African region of the world.
All right, thank you so much, Jeanine, for the moderation. I would like to first of all introduce our first panelist. He is no other than Professor Cyril Usifo, FPSN. He's a professor in the Department of Pharmaceutical Chemistry, Faculty of Pharmacy in the University of Benin in Edo State. He's currently the president of the Pharmaceutical Society of Nigeria. That's my president.
Nice to be with you.
He's also an external examiner to some Nigerian and foreign universities. His vision is to transform for the transformation of the pharmacy profession for enhanced profitability, prestige, and to create an enviable profession in Nigeria through strengthening of a collective capacity. His emphasis is on the leadership engagement in pharmaceutical industries and governments to enhance production capabilities of high quality drugs and be a hub for the ECOWAS sub-region. He has received awards from the German Academic Exchange Service as a DAAD, and is also a principal investigator for the TETFund National Research Grant. His engagements in advocacy and policy include as chairman of the University-based Center for Excellence in Africa, the mandated platform for sustainable and significant working partnerships between African leaders in pharmacy education and development, and also in the FIP. We are so pleased to have you, Professor Cyril Usifo.
Thank you very much.
Also with us will be another panelist. The floor today is no other than Giselle Atami, who is an associate professor and head, Department of Pharmacy, Faculty of Medicine and Pharmaceutical Sciences, University of Douala in Cameroon. She coordinates the lab for pharmacochemistry and chemistry of natural pharmaceutical substances, and also pharmacy specialty programs. She stimulates research on valorization of medicinal plants through drug formulation, and she leads partnerships with multiple international universities. She's a WHO and FIP expert for the development of training modules in the information and detection of substandard and classified medicines. And also, she partners with the DAAD and Association of African Universities in quality assurance and pedagogy in higher education. She's a pedagogy.
Okay, and it looks like we have Onyeka frozen for a moment. So we have Dr. Michael Mangoma, who is a panelist with us today. Welcome as one of our featured panelists. Dr. Mangoma is Dean of the School of Pharmacy at Mount Kenya University and is a lecturer of pharmacology and toxicology. Onyeka, you want to continue on with Dr. Michael's introduction for us today?
All right, sorry for that.
Okay, I'll continue. And when Onyeka's on, he'll jump right back in. So he also is involved with training the trainers in quality family planning health services by the provision of community pharmacists in Kenya. And he is chair of the education committee for the Pharmaceutical Society of Kenya. He also is a toxicologist by trade, having expertise in medications and poison and the management of that interaction. And his focus is on higher quality education, technology solutions, and thinking about pharmacy and operational improvements. I know that's one area I'm excited to hear about that he speaks on today. And Dr. Michael has been involved with project management, mobilization of community pharmacies within Kenya, and has really been an influential individual working with policymakers and implementators for the development of user materials and information. He is editor of the Pharmaceutical Journal of Kenya, and he is a member of the British Toxicology Society. So a warm welcome to Dr. Michael Mangoma today. Thank you, Doctor, for being here with us today.
Thank you so much, and I really look forward to this session. Thank you.
Okay, last but not least, we also have our speaker, Dr. Andy Gray. Dr. Gray has research interests in policy analysis, in particular, the development of national medicine policies and thinking about rational medicine use and the application of antiretroviral therapy in situations where we have constraints to the resources that are available. He is also a senior lecturer in the Division of Pharmacology, which is a discipline of pharmaceutical sciences in the School of Health Sciences. And Dr. Gray, you're going to have to help me with pronunciation for the University of KwaZulu-Natal.
KwaZulu-Natal. Pretty good.
I did.
Thanks,
okay. Yay. In South Africa. Thank you for helping me out, Andy. And we are especially excited to have Andy as well. He is designated as a WHO, or his discipline is designated as a WHO Collaborating Center for Pharmaceutical Policy and Evidence Practice, but he's also the current director of the FIP Foundation for Education and Research and has roles in that area. So Andy, thank you so much for being here.
Thanks very much.
Okay, and last but not least, we have Sergey Nomar Sar, who is unfortunately with us in video format today due to an unavoidable conflict. We know that those happen last minute, and I know you can all feel the strain of those challenges to our schedules that come up last minute. But Dr. Sar is going to share some expertise based on his perspective of physiochemical analysis and controlling medicines and foods in his roles. He looks at the quality of medicine and food and the promotion of medicinal plants and looking at the development of alternative analytical strategies. He has had leadership roles in the WHO FIP projects that are involved with developing a pilot course for medicinal products and leading the West African Postgraduate College of Pharmacists. He also is involved in academic council work. He is a Knight of the National Order of the Lion of Senegal, and he is a chief editor of an international journal. So we are very pleased to have his expertise. Okay, so for today, we have some objectives that we're going to hopefully work on, highlighting for you today in this session some challenges that have been identified by our academic stakeholders, particularly focused on their region, and thinking about how we can align pharmacy educational advocacy to policy changes that we want to see as we think about the advancement of pharmacy practice. We're going to summarize some best practices at the end that the stakeholders have shared with us today. And we are going to look for collaborative methods that FIP can be involved in to assist with the advocacy efforts with educational policy development worldwide, and to help with what the FIP academic section provides to you. So a little bit on today's structure. We have had our panelists introductions so far today for you. Now we're going to proceed to our facilitated discussion with our panelists. And I will begin with each question with a primary speaker for the question. If time allows, I will go to additional panelists to comment. And we will then, after our questions, proceed to looking at audience interactions. So we want to hear from you today. We want this to be responsive to your thoughts and to your ideas. So we will have some questions that we want to see answered from you, where we'll ask you to give your input. And thanks to our chat host for being able to look at that and put that together. And then at the very end, we're going to have Onyeka summarize today's session and some takeaways that he has so that we can put that together. We also want to let you know that we'll be highlighting all of our speakers in a digital spotlight. We will have a display that kind of highlights some of their expertise or background. And so we hope you look forward to that in the future to be able to learn from their wisdom and expertise. Okay, so with that, I am going to begin our question and answer portion. So I would like to ask Dr. Cyril today, what challenges have you faced in the past related to advocacy and policy within your particular region or country? What are some things that you have experienced that you would like to comment?
Thank you very much, Jenny, and I'm confident that at the end of the day, we're going to have some robust discussion and way forward. Going directly to the question, thank you for having me. Challenges we face with regards to advocacy has been principally trying to get appointment for discussion with those stakeholders who are concerned. One of them is government. You might want to have a particular time that is convenient for you for an appointment, but government is not willing to do that. Most of the time you get short notices for appointment, making it almost impossible for you to make it. There was a time I got an appointment, and even if I had a private jet, it was just impossible to make it. But for me to get a connecting flight would take me about 3 hours to get to Abuja. However, the government has been quite responsible by rescheduling some of these appointments. For example, on Monday, I had a rescheduled appointment. We're going to have a meeting with the Honorable Minister of Health and Social Welfare. We also had an appointment with the Minister of Justice and Attorney General. That was very smooth because we were given enough time for such type of appointment. And two is the fact that developing what to say when you meet the various stakeholders, not just government alone, even other players in the place, you realize that you need people who take time to help you develop some urgent and important issues to discuss with government. Because these appointments are rare, and when you have them, you need to utilize them to the fullest. For example, for the appointment of Monday, we have been developing papers and we've been talking about issues, and we just don't want to discuss with government or other stakeholders. We also want to leave a paperwork of what we have discussed or what we intend to discuss, and that will help us to channel things and make reference to it later in the future. Then we also talk about leveraging a relationship government. It's very important. You might know somebody who knows somebody in government, making it easier for you to do that. But I found out that you don't necessarily have to rely on a few things, but you rely on a good network of persons you know. Then we finally is the fact that putting pressure on various stakeholders to change policies is normally very difficult. But we cannot rest on our ass. We have to keep on putting pressure in any way we can. Lastly is the fact that if these policy change makers, whether in the legislature, if they are not willing to listen to you, then you need to go to the print media and air your views. And going to the print media to air your views is not that cheap, because for you to have a publication will cost you quite some money. But we have, in our society, allocated some funds towards that so as to be able to pressurize. And so in a nutshell, let me just say these are some of the things, challenges we receive, but by and large, we are weathering the storms. And I'm sure I will stop there so other people can make some contribution.
That's excellent. So I would love to hear from some of our speakers. Dr. Cyril, you mentioned the challenge of coming up with what you're going to say to the policy members or to the government members when you have that opportunity to interact with them. I would like to ask Dr. Gray, what are some strategies that you use to identify your topic or your focus points that you're going to mention? How do you keep their attention with that brief time that you have?
Thanks, Jeanine. So I think the key is to have prepared a document which summarizes the evidence on which you want to make your point. And it might be an FIP level document, or it might be something national. If it is FIP, you want to add to that a national flavor. So is it appropriate? Does it fit? Is it contextualized in our own setting? And then what is absolutely key to engaging with stakeholders, particularly politicians, is brevity of the message and giving them solutions, not just problems. Don't tell them what you don't like, tell them what you want to have changed. And that might be one way that you can get them excited.
I love that. I think that resonates for just hitting those key points. Dr. Cyril, is that your strategy as well as you try to engage with different individuals and
Yeah, very interesting. As Grace spoke, I just looked around and I said, yeah, that's one of the things we've been doing that, and it's been yielding good fruits. And in addition to what Grace said, we also make sure that we leave behind, like you mentioned, a copy of a printed document. So not just discuss with politicians as stakeholders, but you leave a copy so that they can refer to. And once in a while, you put up a letter to them, reminding them of the meeting and the discussions and what they have not done concerning what you left behind.
That's great. So some follow-up is necessary to be able to kind of stimulate that discussion as you move forward. Excellent. Okay, I would also like to hear from Dr. Michael. Dr. Michael, do you use the media as a strategy as well, similar to Dr. Cyril, to put the attention on issues or focus that might come up?
Yeah, thank you so much. Yes, media for us is a very powerful tool, and not just as a university, but as a society that I also represent, the Pharmaceutical Society. We look at certain thematic areas. For example, one that I will talk about currently would be the issue of the different cadres, technicians and pharmacists. And part of what we advocate for is best practice. And we try and look at what's there in policy and what's there in terms of the law as regards who is able to handle what schedule of drugs. And the media becomes a very, very powerful tool in terms of communicating out there to patients and clients, because I think safety is one of those things that we really prioritize. And when we use the media again, we can really start touching on policymakers and policy implementers out there, and also just ensure that existing policies are again reminded and sort of like become a focus at that point. And yeah, I would totally agree that media would be something that we use, both social media as well as television. So every now and then we would come on television just to speak about certain aspects of the profession and practice. And of course, now that has a direct impact because we also highlight the education bit of it and clearly communicate to the public how long it takes or what sort of level of education would be for different cadres. Yeah, thank you, Jeanine.
Oh, that makes a lot of sense. So I'm hearing from our speakers, I don't know if I've summarized you correctly, and please let me know if not, but a challenge is tailoring the information to, the relevance of the viewer, whether that be government or whether that be the general population, to really help them understand why that is an important point or an important challenge for the profession, and how that contributes to advancing patient care and advancing safe medication use.
I know. No, can't.
Excellent.
No, man.
Okay. So I'm going to continue on kind of thinking about this. As we're thinking about these challenges, I would like to ask Dr. Giselle Atami to speak to what are some of the best practices that you have seen when you have approached policy and advocacy in pharmacy education in your country or in other locations.
Thank you, Jeanine. Thank you for this webinar. I think it will be very important for all the pharmacist community. I first apologize because I'm in a conference, as I write, in Paris, and the connection is so bad. Sometimes I don't hear you. So I apologize, because also I'm not sure that I'll be with you until the end of the webinar, because I have a session now in a moment. I left the previous session to start the webinar. So I ask you if I can put off my camera, because the connection is very unstable in the conference room.
Yes, I think that is okay, Giselle. We would rather hear your thoughts, and we definitely understand technological difficulties. Those plague us all, no matter where we're at.
Okay, thank you. Because the connection here is so bad. So I cut my camera. Maybe I put it on after doing the sunrise. So,
yes.
Okay. So if I can answer to the question, I can share my experience. I talk specifically, sorry. Okay. Talk specifically about the Cameroon. Education policy is a major concern for the leaders. So they regularly consult with the representatives of the academy, and our leaders are not afraid, political leaders, I think. The person who makes the decisions, they are not afraid of reforms when they are necessary. And there is a lot of curricular review, seminars, and trainings with all the various stakeholders in all the training sectors. So in terms of pharmacist training, the training have been adapted to our context, in which the market of locality medicines is very important. It is a scourge here. Training that gives pharmacists all the tools they need to be a professional in the proper use of quality medication, and a professional who can raise awareness of potential dangers. So it is one of the best practices in our countries. For myself, I face the challenge of setting up a new training pathway. I was a part of the team that launches the pharmaceutical training sectors in Cameroon. And one of the challenges was to the development of curricula. A training adapted to our environment, including participation as an expert. I was an expert in the development of teaching modules of standard and falsified medicines, because the poor quality medicines, as I said previous, and the informal sector are scourge in our country. It is a big challenge for us, for the pharmacists. I was with Professor Sarr. We were the expert for the FAPhA group to elaborate the modules for to elaborate the modules. Somebody is speaking to me at the same time. To elaborate the modules, to learn those lessons on falsified medicine. So I had also another challenge. It was the harmonization of the program of teaching pharmaceutical students. Because when we start this faculty of pharmacy, each of faculties had their program. And it was very difficult because we have started this challenge of harmonize the programs, and we have just completed the program harmonization. We do we have a meeting in 3 months to do the evaluation of the harmonization program if you have to modify something. And then, so these are my sharing experience of the best practice.
Very good. So, Doctor, as you're thinking about that harmonization, what are some of the strategies that you use to reach consensus on what approaches you should be using, or what people want to put together as they're developing content for education and also for the policy?
Please, can you repeat? Somebody is
absolutely. So how do you what strategies do you use to get to consensus with different individuals if they do have different approaches to education? How do you kind of work together to get to that consensus?
Okay. The strategy with the community pharmacy, or the strategy with all the academic leaders?
It can be both. I know we've been talking a lot in some of my coursework about just the challenges of constructively, managing differences of opinion and, getting to that point of, what do we want to prioritize as a team or a group? So what are some of the things that you do to make sure that you're looking at all of those best components of those trainings or practices?
Okay. The first strategy was to develop with all the leaders of the academic in my university. I have to convince them that it is necessary first to put faculty of pharmacy, because we didn't have it. Is very recent in our country. And it is necessary for the training for pharmacists to choose the modules we propose. So they agree because we are a group of academic pharmacists who wrote a kind of plaidoyer to them. And after, the second step was that to choose at which level. For example, I not speak generally. I speak for the implementation of the module against falsified medicine. So the second challenge was to choose to propose at which level of the study these modules were to be inserted. So we chose the fourth year because after a lot of discussion, because it corresponds to the beginning of master's cycle, which is the beginning of the pharmacy students training in professional subjects and teaching. And finally, the final challenge was to choose how many credits we allocate and how many hours we allocate to this curricula. And finally, we convinced them to allocate 40 hours and 4 credits. But yes.
So I'm hearing you started kind of more broadly with why do we need this and why are pharmacists the right individuals to deliver this content? And then you developed some of the specifics and answered the questions of timing, of format, of those different components. Is that a good understanding of kind of your approach to developing some of that curricular content?
I don't have the return of this. Hello.
Hello. Yes. So, Doctor, I really appreciate that expertise. It was really good to hear just the credit load that you assign to a particular area and your strategy of educating why pharmacists were the best individuals for providing that, and seeing how you developed its positioning within the curriculum. Thank you for sharing that and for giving us that example of how you've developed that expertise related to falsification of medications and other components. I am going to, if you're all right with it, go back to Dr. Cyril. Dr. Cyril, can you comment for us, just Dr. Yusuf, can you respond for us today on this idea of best practices? Is there a best practice that you have seen that is similar or different to what Dr. Atami mentioned for us today?
The truth of it all is the fact that you will need to be able to liaise with the university administration, one, and then also with people, your colleagues, so as to be able to place properly policies that are relevant in pharmacy education. I mean, I just give an instance. I was dean of faculty of pharmacy when we're transiting from a traditional B Pharm to PharmD. It was met with resistance from various quarters, but most of the resistance came from within, from colleagues who are pharmacists, who probably didn't know we're moving from product-oriented to patient-oriented. So we needed to educate, and you won't believe it, you cannot do some kind of advocacy colleagues who are pharmacists. But by the time we got everybody on board, we were able to move to, as a family, as a group, to the university, to the Senate, and people began to understand what we were doing. Then we went further in terms of politics. I had to contest to represent the university in the board of a teaching hospital where we have a lot of physicians. And there I was able to also explain to them. Fortunately for me, the chief medical director was a classmate in the higher school, and he has great regard and respect for me. And we were able to explain what we wanted to do. We were not going to take the work of the physicians away. We're only going to complement the activities. I related an incident where I visited the Atlanta Medical School, and the physicians there were grateful to pharmacists that without pharmacists, their work won't go well. So when we relate things like this together, people become educated. They may have degrees, but then they can understand a lot of things that are going on. And we can now perpetuate and draw the right policies for pharmacy education.
I love that. So you're leveraging the power of your personal connection to make that initial discussion with physician groups, and then also unification of your voice, and making sure that you're all within your university are understanding the importance. So even education within the pharmacy perspective. Dr. Atami, is that also important for what you have seen at your university? And if we're not able to hear her, we'll ask Dr. Michael. Oh, great. Yay.
Sorry. Connection is so unstable. Yes, we face
That's
the same. Yes, I can say that I face the same problem, the resistance of some colleagues at the beginning. But the administrators of the university were very sensitive to the question of the pharmaceutical education and of the education of the pharmacist. But after the problem was solved. So the difficulty was there.
Yeah, you got to start somewhere to get them going. Dr. Michael Mangoma, can you tell us, what were some of the best practices? Is that very similar to you for what you saw with it being important to, have an alliance within the university?
Yeah. I mean, I totally agree with what the other panelists are saying. And for me, I mean, a good practice would be to communicate advances in our profession so that everyone is up to date, so that nobody feels like there's this professional, this school that is bringing something new and is stepping on our toes. The inter-cadre war is something that we cannot avoid, especially in the health space. And as we continue growing in this healthcare space, we realize again that certain aspects like primary healthcare is slowly becoming, it's increasingly becoming a shared responsibility among healthcare cadres. We have pharmacists providing immunization, which includes injections, which essentially means that they have to be skilled even at the pre-service level, meaning at the university. So when we get the medical school, we get the nursing school together, maybe a clinical medicine school, and get them to understand that life is changing. Things are changing. The pharmacy profession is changing. We're moving away, the whole of Africa hasn't moved, but it's important, just like Professor Cyril said, the bachelor program moving on to the PharmD. We are also facing a very serious resistance at the moment in Kenya. And it's all about really trying to be factual, even as we interact with people. And that would be one best practice to really influence policy in pharmacy education. Yeah.
I love that. Thank you for sharing that perspective of making sure that everybody understands that it's not detracting or taking away from their role, but enhancing or collaborating and evolving. So I'm going to continue on with this and, say, you started to give us this example of advocacy in your region, but describe some of that implementation process for us. You mentioned some of the challenge. Describe what that looks like to make that occur in your country, and what some of the highlights or things were.
Yeah, so maybe you could allow me to be very specific, because we've just gone through an interesting cycle in the last 2 years. And the cycle here with the pharmacy education was actually pushed by some advocacy program that I was involved in, and that is introducing family planning, quality family planning services, as well as vaccination into the in-service, meaning those that have already graduated, but also targeting the pre-service, so the universities. And for us, we used a smart advocacy sort of framework, and it had several sort of layers or steps. And initially, we just wanted to understand the environment and make assessments of what gaps are there in policy. And we're able to identify certain gaps, because when it comes to the pharmacy profession, the law in our country provides that we should be able to provide pharmaceuticals. And sometimes that provides, I think it was very useful, because it allows then the whole range of pharmaceuticals to be provided by the pharmacist. And in that case, we also thought of, well, we could include also injectable contraceptives, because anyway, we are the custodians of these medicines. And over and above that, again, we can also be trained to provide some of these services and some of these commodities. And then we went ahead to look at, so who do we involve exactly? And we started at the top, meaning government, looking at the various departments, the Ministry of Health, and even at the Ministry of Health, we were looking at very, very specific departments that could support some of these changes, could support some of these ideas. And went down again to look for universities, again, that are like-minded, as well as practitioners out there, not only from our field, which is pharmacy, but we got nurses in, we got medical doctors, gynecologists. We also brought in a few people who were just involved in, human resource management. And then we went ahead and just distilled the whole thing and looked for very particular objective. What exactly do we want to achieve, trying to manipulate or change or influence the education of pharmacy? And here, the education of pharmacy, we're thinking about, so we were very, very specific. There's continuous professional development, which is, of course, in the in-service. And then there's the pre-service, where we also want graduates who are coming out to be able to address global trends, national trends, and what is expected as this profession is evolving. And then we went ahead again and just looked at, so we need to identify the exact person or the exact office who can actually give us this go-ahead. And after that, again, now come up with a very, very clear framework or a clear work plan. How exactly do we do this? And for the family planning, we brought together all these players, shared some of our findings, the desk reviews, and identified the gaps, highlighted the gaps, had sort of like a proposition and said, you know what, this is the gap. We are having a low contraceptive uptake, and we have all these healthcare workers who are said to be the people designated to provide family planning services, yet we have these other cadres that seem to be providing a certain level. And for pharmacists, we're saying here emergency contraceptive pills, we're saying just the normal pills, and even some of the other methods. And we said, you know what, why don't we tap into this, upskill them, train them to provide injectable contraceptives, and then we should be able to cover the gap that the government has clearly put out there based on statistics and based on science as something that has actually been inputted in their family planning goals. And then from there now, we presented a case, came up with, for us, we went ahead to come up with a curriculum. We actually came up with a curriculum. And with a curriculum, we got an endorsement and approval from the relevant officers again, and we're able to pilot it and roll it out and have trained pharmacists to provide quality family planning services in a very structured manner that is being reported back to government and has very, very clear, dimensions of safety and all that, with pharmacovigilance being at the center of it, quality assurance being at the center of that. And then we went further and looked at, again, so how do we scale these up so that it gets to the pre-service? That way we realized, or we went back and remember that we actually have a regulator, yeah? And part of the job of the regulator is to come up with a national core curriculum, yeah? So that this is something that every other institution that is coming up or training pharmacy should be able to adopt as a skeleton. And we said we're going to influence that. And we were able to take advantage of an opportunity where the core curricula was being reviewed. And we brought in the case and said, you know what, this is what the policy says, and these are the gaps that are there. We need to skill up pharmacies because primary healthcare is coming to private sector, to community pharmacies. We need to be ready. And we were able to get these modules into that during the revision. And this was accepted, and it went through the process. And now we have, we have a journey where all cadres in health really appreciate how we were able to change the policy, influence policy, introduce something in the pharmacy education, whether it's at the pre-service or at the in-service. And positively impact on the general healthcare. Of course, the challenges are there. The resources that go into getting this done, whether it's financial, whether it's just getting people in to consistently remain throughout the journey, because this took so many years. You get people dropping out every now and then. You get we got the whole thing of the inter-cadre wars, and people saying, why are you coming into a space this? But we remained factual. We were saying, by doing this, we'll be able to achieve this. Yeah, we'll be able to achieve this to our clients, because at the end of the day, it's not about us. It's about the patient. It's about the clients. And by system strengthening, we only add value by ensuring that these commodities are there, these services are being provided, and that even as a pharmacist, you stop being a vendor and you become a service provider. So that was one of the gospels that provided a bit of sort of fuel to the whole journey, so that we stop just dispensing and selling. Yes, there's a business aspect to everything. We need the money, but however, we were thinking about the bigger picture. Once you're able to prove yourself as a service provider, then what else can be embedded onto all the services and actually increase your profits? So yeah, those are some of the things that we went through, and I think we are happy so far. The journey is not yet over, but so far I think we're doing a good job. Thank you.
Dr. Mangoma, I love that example. I think that really emphasized also some of the things Dr. Atami spoke to with developing a structure within your university or within your curriculum to support the development of those skills that individuals need to have. I'm going to go to Dr. Gray because we didn't hear from you in the last question, and ask you, is that similar to your experience with kind of thinking about that implementation process? Where do you look to for the source of the implementation process, or is there a guide or a structure that you like to utilize as you approach advocacy and policy change?
Thanks, Jeanine. So I want to focus on a very similar process in South Africa, and that is extending pharmacist prescribing rights. So going beyond just the scheduling of over-the-counter sales to a specialist register for those who've got additional training. We've got an established process for what we call primary care drug therapy pharmacists, but the list of medicines is limited. And there was a real desire to expand that to include initiation of antiretroviral therapy and the provision of pre-exposure prophylaxis for HIV. South Africa has the largest antiretroviral treatment program in the world and has a very high prevalence of HIV and a high incidence of new cases. So access to PrEP is absolutely crucial. So we not only needed to be able to rely on global documents, WHO's task shifting policies, for example, the collaborative practice standards that had been worked out together with our partners in the World Health Professions Alliance. But we needed to be able to fight in court when challenged. And that is a process that's not yet completed. A High Court decision went in our favor, but has been appealed to our Supreme Court of Appeal. So when you are in this contested territory, what's really important is to have the resources, have the means to be able to use whatever is necessary, not only to advocate, but at times to litigate in order to get what you feel is right for the patients, for the clients, as Dr. Mangoma put it. Thank you.
So financial resources also dedicated to that, and appropriate knowledge and staff to be able to do that. I'm also hearing that many of our speakers are talking about the challenges of the duration and the sustainability, also maybe some scalability of like thinking about starting with one drug or starting with one component and then expanding upon that as we go forward. Dr. Atami, can you comment for us? Is there an approach that you use to keep yourself, motivated to keep others engaged in that discussion over time to ensure that you're really able to achieve those outcomes that you would like to achieve? And we'll pause a moment just because we know, again, technical challenges can be difficult as well. And I will go back to Dr. Cyril and ask Dr. Cyril, can you comment, what is a way that you keep people really focused or engaged with the topic over that length of time as we're trying to, continue our discussion on, a focused area or an area of advocacy that you want them to advance in?
One major area we have done successfully here has been to engage, sounds a little bit unusual, those who are the recipients of our students, so to say, when they finish in the community, in the industry and other places, we get feedback from them to help us reshaping our curriculum and what we need to emphasize on. That has earned us a lot of credit that persons see what we do here has been very important. It might interest you to know that we even follow up by making sure we visit our former students and keep in touch on what they are doing. One that got in touch with me is a country director of a non-governmental organization. And we are trying to see how we can bring her to come and share our experiences a couple of years with the students who are still on ground. In that way, students will be able to appreciate what the older alumni are probably doing in the society. I haven't said that we also have related with those who are not in academics, but that's one of the things we're doing presently now. We get adjunct lecturers from community pharmacies, from hospital pharmacies, from industrial pharmacies, who are part and parcel shaping activities in the educational sector. That helps for good implementation and success, and we were able to look at our challenges as well. We believe we can. It's like, somebody who bakes bread for somebody to consume, and you don't ask the person the taste of what is consuming. So we involve them. They are the consumers of our product to come in and shape what they think are not proper in the system. Finally, on that aspect, we also believe that we also need to engage people who are not necessarily government, but have private universities who have the funds to establish schools of pharmacy. We did that the last 5 years, the pain of where we believe that we don't have enough pharmacists on ground, and we need to have more pharmacy schools, maintaining quality and standard. But it's been paying off because some of these individuals who have enough funds have set up schools of pharmacies in private universities. And that has helped a great deal in shaping the success and overcoming challenges in pharmacy in my country.
No, thank you. So I was hearing some messages of re-engagement of individuals in establishing relevance. Dr. Gray, for our fourth question, can you talk about some of the ways that you feel that the FIP academic section is an important partner in assisting with you influencing education policy in your region or your country?
Thank you, Jeanine. So the real richness of FIP is the ability to make connections, to share information, to share resources, and to develop things together. It's absolutely crucial that the section identifies what the key issues are that their member organizations and individual members are finding important, and focus the development of, as you put it, toolkits or resources that can be used. I think one of the key areas that is being addressed in many, many countries, even in the African setting, is the idea of specialist training. And there are various models of doing that. I've found that our own pharmacy regulator is looking far too closely at the medical model of medical specialization, which allows somebody to practice only in that specialist area, not as a generalist. Pharmacy has a very different approach. And in particular, I think FIP and its academic section would really benefit from closer relationships with the Board of Pharmaceutical Specialties in the US. That's been really successful in moving some of these debates in the EMRO region, in the Eastern Mediterranean region, and in the Gulf countries. So getting that better understood in an African setting, I think could be a really good focus area for the academic section. Thanks.
That is important. So you're mentioning, again, really being on the pulse of what members need and what resources are critical, and understanding the context in which challenges or opportunities exist in providing resources. I would like to ask Dr. Atami, if we can hear your voice, if you're still there with us. Are there ways that you have engaged in partnerships with FIP or other groups specifically to being a resource for you to influence education policy?
Yes, Jeanine, I'm between two sessions. So
that is okay. You're doing amazing. I admire your ability to navigate those spaces.
Okay. So what was the question about the partnership we engage with other universities?
Well, specific to FIP academic section, how do organizations play a role in being a partner to influence education policy in the African region or your country?
Okay, so the partnership we engage is with some European universities, like Paris-Saclay. We have a mobility for the student of a fourth year of pharmacy. They come to Paris for the second semester. We have a kind of selection, and we select 2 students for the fourth year of pharmacy and 2 students for the 7th year, the last year of pharmacy. The students of the last years, they come in Paris-Saclay to work on the thesis project in the lab. It is a lab partnership just for the research. But the student of the 4th year, they spend all the second semester in Paris-Saclay at the Faculty of Pharmacy. We have we choose what lessons they can follow, and they have an equivalence for this semester in our university. And this is a partnership for Paris-Saclay, the partnership with Paris-Saclay, and the partnership with University of Liège in Belgium. For example, it's just a research partnership. It is a student at the last year of pharmacy. And we have also a partnership with between the teachers. So the teachers of Paris-Saclay, they come to University of Douala faculty for 2 weeks, and they teach They teach biotechnology. We choose every year. Have to choose to work with them. They teach on seminars, and teachers of Faculty of Pharmacy of Douala. We come also in Paris-Saclay, and we do some seminar basically on medicinal plants, ethnopharmacology, phytopharmacology, also for 2 weeks. This is a kind of partnership. With African University, we don't yet have. We are looking for. Maybe we start something with the Senegal and Professor Massa, but we are looking for partnership.
Yes, that's great. I mean, there are always these amazing opportunities, I think, within the academic section to network and to make these connections, whether or not it is in this webinar or it's in other places. So hopefully, yes, that will foster a partnership or a connection. So I'm hearing that FIP can play a role in providing a space to make those connections or identifying individuals that are working in similar spaces to help the advancement and development of those relationships. And then, Dr. Hatami, I'd really appreciate how you talked about the role of the university as well, and bringing in specialists or working with universities to have structures, trainings, best practices emphasized as we seek to better understand how to provide care and how to share expertise in a particular area. That was, I think, very meaningful to think about the need for aligning those resources in the same space. Okay, so now we want to go to Barry Blight, and we also want to go to Nadia and Nadia Almarizi. And Nadia and Barry, can you tell us what are some of the things that you've been seeing in the chat? First off, what are some of the things that you have heard mentioned, and where do we have representation from today in our session?
Well, we have a whole lot of people from all around the world, but we do have a lot of people from Africa, from Rhodesia, from Nigeria, of course, Morocco, Cameroon, the Middle East. We have quite a few. We go into Ukraine, some USA, some Saudi Arabia. But one of the questions that came up, and it's very impressive to see that, because as they were saying, it's interesting to get to know the world's challenges. It seems like we all are in the same boat. You know, USA may have been PharmD now for over 20 years, but we're still going through some of the same issues post-PharmD, and we can get into that at another time. But one of the questions that was directed at Michael was Elijah Muhammad wanted to know what was the role that the Pharmacy Board of Kenya played in, in his topic. If we can get Michael on.
Thank you so much for that question. So the board is known as the Pharmacy and Poisons Board, and that board is the regulator. So what they do, they regulate the practice of pharmacy. They do registration of pharmacists, but over and above that, they also have a mandate of developing a national core curriculum for the training of pharmacists, because they also regulate institutions that train pharmacy students, whether it's at a bachelor's level or at a diploma level. So the role they play in terms of influencing policy and training would be to ensure that, one, they review the national core curriculum every number of years. I think it's 5 years. And that the review reflects the trends or the expectations of the pharmacists as they keep evolving. So as we were going through this process where we influenced, we basically took advantage of the gap that was there, the timing. I think the timing was just right. They were the process of considering the review process, and we were able to come in, one as the Pharmaceutical Society of Kenya, and two as universities, with the support of other stakeholders, including, again, the Ministry of Health, but of course the board is under the Ministry of Health, but a department in the Ministry of Health, the Division of Reproductive Health, and bring in this aspect about family planning, because clearly, based on the information from government, there are aspects around family planning that need to be addressed. However, even with the capacities that we have in the healthcare force, we still need more skilled workers who could address that issue. So we took advantage of that, and the Pharmacy and Poisons Board was happy to also facilitate this process and ensure that this was included in the reviewed curriculum. So that's how they came in. Thank you.
That's important to make sure there's an alignment of the workforce and the laws with also the education and training.
Yes.
Nadia. Yeah.
Yes. Thank you very much for letting me saying. I want to also to summarize certain points. I found it very important. First, I like the challenges in getting an appointment with the government or stockholders. This is one of the challenge. You'll find it in many countries, that to get an appointment with the government, because always they are busy with other things. So advocate to trying to get appointment to explain their point of view about certain things. This is a very important thing, and I like also the strategy with which being telling that you have to tell them what they want, not what you want, to try to attract them and to try to advocate against your point of view. Also, there is advocate to apply the best practice concept through media, through TV. This is good in communicating with public, and also to educate them on what's going on about a certain disease or certain matter. This is a very good point also. Regarding also pharmacy training to elevate the students' competency regarding the falsified medications, or so they will know how to apply and dispense the high quality of medication. This is a good also a challenge in the logistics point of view and the supply chain management, and this is the best one going to speak about it or to advance it is the pharmacist. Also, in regarding the evaluation of the students or the learning outcomes through education-based learning, through many concepts, like, for example, practice-based learning. So changing, there is a gap between always the education and the practice. So always when we are following the education, changing in education, like from PS to PharmD, we will find ourselves very slow in comparing with the practice, because the practice they are moving fast. So this is, we should co-op or moving with in the same way. So we have to be we have to be having a good strategy in applying practice-based learning. Like, for example, when he speak about the experiential training, interprofessional training. So this is the way. Before, everyone was studying alone. Now in our university, like in Sharjah University, we are going to the concept of interprofessional training inside the college. So when they were going to the workforce, they will get the proper training in working together with other professions, like, for example, physicians, dentists, nursing, physiotherapists. For all of these should be also highlighted in. The last one also, the challenge, what we said, that this is always also we faced in our country, like the challenge, the changing from PS to PharmD. Some pharmacists, like certain specialization, like pharmacology or something, they found, or the medicinal plants, they found that they are stuck to the pharmaceutical, to the science, not to the clinical. And all the world is moving for patient care services. Resisting the change, this is available. So we have one also in the chat. He discussed it. He said that we should know why they are afraid of the resistance people, or the resistant. We have to look for them, why they are afraid, and we have to see how can we let them engage in the changing process. This is will facilitate also.
That's
and you know
great.
the role of FAPhA is very great in achieving also advancing pharmacy profession for all the world. So we have to link between the education, the training, the workforce, and also the development of specialties in the pharmacy profession. Thank you very much.
Thank you so much, Barry. Are there any other themes that you're seeing in questions in the chat that we should note?
There's really good discussions, as Nadia just pointed out, about interprofessional education, and then also discussion about specialization. You know, some people think it's very important. Other people saying we can't leave the, you know, but Martin's brought up some very good points that we have to keep the general practice of pharmacy strong, because we can't leave the public without all the medication expertise they should have access to. I'm quoting him on that one. So I think there's some really good points in all of this as we're moving forward. Certainly in the United States, when we moved to the Doctor of Pharmacy, we did not leave the dispensing away. So, but it's a new world. We've got with AI coming in, who knows what's going to happen. We need to be really at the forefront of some of this stuff. So just a lot of good questions, and a lot of people very appreciative of FIP bringing these topics forward, and everybody getting to say, hey, we're all in the same boat here. So I'll put a plug in for Andy that we all need to be going to South Africa, to Cape Town, to the meeting.
Excellent. Yes. So thank you so much to our chat moderators today. And Andy, we are excited to come to South Africa in the very near future, next September, to engage in those discussions with FIP and with other individuals.
Thanks, Barry. That was perfectly timed. Thank you.
Okay, so
I'm looking forward to going. So I've already got my reservations. I'm already there.
Great stuff.
Barry has some best practices with getting ready for your FIP educational meeting. Onyeka summarized for us some takeaways from today. And as we're looking towards thinking about some of our components, he talked about meeting and interacting with stakeholders as we're thinking about they have the policy power to enrich the capacity of pharmacists and to really shape the profession and the work of new graduates. And he also commented about tailoring the pharmacy curricula and saying that it was vital that we tailor the curriculums of pharmacy education. Our speakers highlighted really needing to satisfy the needs of the 21st century to evolve and incorporate both older practices and knowledge, and also modernize for the 21st century students. We talked specifically today about thinking about how that training could address areas. And I know the FIP academic section has been active in India right now, doing some immunization training. That was one area that was mentioned. But we also talked about antiretroviral therapies and the importance of that around the world. We talked about supply chains, and we also talked about harm reduction strategies. I know, very excited to hear the words ethnopharmacology and pharmacognosy. That's a space that I love and work in as well. We also heard a lot of comments from our participants and from our speakers that FIP is an important role in creating these linkages. And so, again, in South Africa, as Barry and Andy were so great to highlight, we will have the opportunities to network, but we have opportunities to network not just at our annual meetings, but also in between. So we also want to hear from you more. I know you have been very active participants, and I am impressed by how many different countries and places in the world that we have representation from today. But we have a link to a follow-up survey that we'll have for you. And I would ask Nadia if you could put that in the chat for our participants so that they're able to see that, or we'll get that posted for you as well. But we really want to know, again, bridging on some of those concepts from the speakers, and also advancing our comments in the chats. What works for you? What specific resources from what our speakers in the African region mentioned do you need to help you with advocacy, policy, and change management? I know we talked about some frameworks or some rationale, some policy that could be applied in other countries to really put the pressure on for best practices, or working with the media. And then who would you like to connect with? Who would you like to see information from? Again, we'll have those speaker highlight sheets that will be coming out in the future to share that with you. Nadia, Barry, Onyeka, I would also like to know, are there any last things that we need to have addressed? And I would love our speakers to come on as we thank you for today's session.
I want to highlight on the role of FIB, that the FIB strategy is advancing pharmacy profession globally and through regional evolving in supporting the workforce development. This is a very good role. So we want to discuss it more, how to do advocacy and policy in that, in implementation of the development goals of FIB. This is, we want you to comment on it. Thank you.
Excellent. Okay, so I see Dr. Cyril. I see Dr. Gray. Do we have Dr. Mohammed?
Yeah, one last thing. I would advocate for with the improvement in technology and ability to communicate. Our colleagues in other countries should think of how to help some other countries in Africa that may not have the workforce concerning some specific area, whether in pharmacology or whether in pharmaceutics. So we could do some lectures virtually that could be of benefit to other countries. And that will result to cross-fertilization of ideas and opportunities that would exist.
Leveraging those lessons that we learned maybe in COVID and beyond, of being able to use great technology platforms like this to be able to bring speakers somewhere quickly in a virtual format, and developing and fostering those resources with capacity limitations. I would ask that all of our speakers join us on camera, and we want to thank you so much for spending a portion of your time with us today, for sharing your thoughts and wisdom. I know I always feel so inspired to hear from experts, and I feel like it renews my passion for the work that we do in pharmacy education and advocacy as it shapes policy and our future workforce. So a huge round of applause to our speakers today. And thank you all for your attendance. We hope that you'll see us back. For those of you that would like to reach out, we do have some of our contact information here for you to connect with us that will be posted in the slides. And our next digital events series will be featuring the Mediterranean region. So if there are some speakers that you would love to hear from for their expertise, we would love to hear from you, and always incorporate your thoughts, suggestions, and ideas. So with that, I will bid you adieu, and I hope that you have a great rest of your day. It's been my pleasure to be able to facilitate today's session with you, and we look forward to seeing you in the future and interacting with you.
Thank you, Jeanine, and thank you, everyone. Bye.
Thank you, Jenny.
Thanks,
Thank you, everyone,
everyone.
and Merry Christmas.
Thank you,
Thank
everyone.
you, everyone. I'm calling also for all our participants or the who's from the Eastern Mediterranean region, if they want to share, to send for me an email on my email, so we can also make the same event like in the Mediterranean region, also to see any other opinion or in policies. And Merry Christmas, Barry, and Happy New Year, Happy holidays.
Yeah. Sure.
Thank you, everybody.
Happy holidays as well. Ciao.
Thank you.
Thank you very
Bye,
much.
everyone.
Bye.